All right, well, good afternoon, everyone, and happy Friday. Thank you all for joining us this afternoon for this month's Tempo Talks session. We are excited to bring back Tempo Talks after taking some time off this summer. My name is Catherine Murray, and I am Marketing Director with HAMIS. I've been a Tempo member since 2020 and serve on the Programming Committee, which works to develop these sessions as well as Tempo's third Thursday program meetings. I'm looking forward to diving into today's session, which focuses on the critical topic of children and teen mental health, which is top of mind for so many of us right now, especially as our kids, friends, and family members head back to school. This topic was actually brought to our committee this past May after two Tempo members connected over a coffee connection where they discussed heightened concerns and questions about mental health effects exacerbated or caused by the pandemic and other factors. We've assembled an amazing panel of Tempo members today who work to provide mental health resources and services to our community. Before we dive in, we have just a few housekeeping items. As a reminder, or for anyone joining us for the first time today, we encourage you interact with our speakers using the chat box and Q&A function that have been enabled. However, this is structured as a webinar, so all attendees are muted and your cameras have been disabled. We'll leave some time at the end for Q&A, but please feel free to submit your questions at any time during this session using either the chat box or the Q&A function, and we will monitor that throughout the event today. We would not be here this afternoon without our generous sponsor, BMO Harris Bank. All of our Tempo Talks have been sponsored by BMO Harris Bank. So before we get started, we'd like to welcome Mary Beth Cottrell to say a few words on behalf of BMO Harris. Mary Beth.
Thank you, Catherine. Hello, friends, and those friends I have yet to meet. It is an exciting day to be back. And for BMO to sponsor, it's especially an important time for all of us, professionally and personally, with what's going on. And according to the World Health Organization, about 450 million people currently struggle with mental illness, making it the leading cause of disability worldwide. September is National Suicide Awareness Month, and tomorrow is World Suicide Prevention Day. So we at BMO are doing our best for our employees as well as our clients and customers to be there to support them in many ways. And today's session is going to be amazing. Really looking forward to the comments. And these Tempo Talks are always so very special because we get to tap into the expertise that we have within our organization. Everyone, thank you for participating and being here. BMO's very honored to be part of it. Have a good session.
Thank you, Mary Beth, and thank you again, BMO Harris Bank. It is now my pleasure to introduce our panelists today. Moderating today's conversation is Ann Ballantyne. Ann is Vice President of Marketing and Communications at Rogers Behavioral Health, where she is responsible for overall system marketing and communication, public relations, and community engagement. Ann is certified in emotional intelligence assessment. She serves as a compassion resilience training facilitator, and she is also a certified yoga instructor. Ann has been a Tempo member since 2016. So thank you for moderating today, Ann. Chandra Cooper is one of our panelists today. Chandra Cooper is a youth and women's advocate with community engagement and youth social services experience. She is a licensed therapist and holds a master's degree in counseling and a BA in marketing communications. She has credentials in child care administration and is a facilitator for First Aids Arts, which is a trauma-informed care expressive arts curriculum. Chandra currently owns several businesses in the Milwaukee area, one of which is Grateful Girls, a nonprofit organization dedicated to providing inspirational, motivational, and enrichment services for youth and women. Chandra joined Tempo in 2019. Our next panelist is Amanda Krzyzkowski, a 20-year veteran in social services. In Amanda's current role as Director of Performance and Quality Improvement at Lutheran Social Services of Wisconsin and Upper Michigan, or LSS. Amanda is responsible for developing, implementing, and maintaining systems for measuring and reporting outcomes and impact. Amanda oversees systems related to risk reduction, quality improvement, and business analytics. She works closely with her team to promote and implement quality improvement through a race equity lens, using data to bring attention to inequities and biases within social service systems. Amanda joined Tempo last year. And last but currently not least is Ann Leinfelder Grove. Ann has served as WellPoint Care Network, WellPoint Care Network for more than 30 years in a number of senior leadership roles, including Executive Vice President and COO, with oversight of all agency programs. She has championed the program implementation of WellPoint's trauma-informed care model, as well as 7 essential ingredients, or 7EI, including programs in child welfare, where translational research has demonstrated improved outcomes through the use of 7EI-based trauma-informed program practice. As CEO, Ann's strategic vision has enhanced WellPoint's partnerships in the community and has advanced a culture of equity and inclusion at WellPoint. Ann has been a member of Tempo since 2018. So ladies, thank you for being here today, and I'll now turn the discussion over to Ann.
Thank you so much for having me as the moderator, and I look forward to really delving into these topics. We're so fortunate to have a great panel. But first, let's set the stage. Mary Beth started to do that, but the stats are staggering. In 2019, 1 in 5 children ages 3 to 17 had reported a mental, emotional, developmental, or behavioral disorder. That was pre-pandemic. It does get worse. Very specifically, there have been a lot of studies that showed 1 in 4 had clinically elevated depression in year 1 of the pandemic, 1 in 5 clinically elevated anxiety symptoms, and we know that this increased over time and are now double the pre-pandemic estimates. A couple more stats we'll just run through very quickly. We know that half of lifetime mental illness begins by age 14, 75% by 24. So getting in early is critical. And suicide. Mary Beth mentioned Suicide Awareness Month and Day specifically. We know that this is the 2nd leading cause of death for people ages 10 to 34. And finally, 50% of teens with a mental health disorder receive treatment each year. The downside of that is another 50% don't. So we know there's a lot of room to jump in. So with that, I think you get the picture. It's local also. We are seeing it in Wisconsin. Children's Wisconsin saw a 40% rise in visits to the ER after the start of the pandemic, and they're saying they're still seeing significant self-harm, suicidal ideation, and significant incidents. And certainly at Rogers Behavioral Health, we've also seen a high demand for services for all ages. And we also know that the acuity of the patients is higher, which means that their conditions are more serious and more complex. So now we want to jump to school. We know we have the pandemic, social media, school shootings, and other violence. And of course, we have elevated levels of anxiety and stress with all of that. So we already had a shaky state of children's mental health, and it's challenging. But let's not stay in those somewhat pessimistic stats. Today, we really want to get started by looking at how students and families can find early access to mental health treatment and resources. And then, more importantly, how all of us can become advocates when it comes to kids' mental health. So I want to start by asking each panelist to speak for a couple of moments, a couple of minutes, sharing what you're seeing in your role. And let's start with Ann from WellPoint.
Great, thank you, Ann. It's great to be here today with such a wonderful group of panelists. And I guess I would echo with some humility that the statistics we've seen related to school mental health, mirror what you shared as we started our time together. Year over year, we've seen a 300% increase in referrals for mental health services coming within the schools and districts where WellPoint works. That is very daunting in terms of what it indicates on one hand. On the other hand, I do think it speaks to the fact that schools and families and educators are recognizing mental health concern and addressing it. If there are any silver linings of the pandemic, it's perhaps some decline in stigma of mental health issues. And that really big 300% number gives me hope that we are striving to support the needs of students earlier and then connect them with clinical resources that can help.
Excellent. I concur that the stigma really decreased, meaning everybody was talking about it and there was less shame around it, and there should be no shame. Let's turn to Amanda. What are you seeing in your role with LSS?
Hi, thank you. So at Lutheran Social Services, we provide mental health services across the state, but I really want to focus on our school-centered mental health program that we have in the city of Milwaukee. And in our program, we've seen an increase of students coming to us with trauma. We have, in the last school year, we saw 70 students, and we had 91% of them had at least one adverse childhood experience, where the national average, according to the CDC in 2019, was 61%. So we're seeing an increase of 30% over that, and where the national average for adults that have 4 ACEs or more is around 16%. Our kids that we were serving had 43. So we're seeing kids that are experiencing more trauma, are coming to us with more concerns. We've seen increases in depression and anxiety within our students, as well as the parents. We've had a lot of parents in this last year very concerned about bullying at school and where that leads. A lot of them saying that some of the cyberbullying happened over COVID when kids were at home and using their computers and phones. And now they're worried how that translates going back to school full time. And we've also seen an increase in conversations around identity and students that are having more and more questions about identity and looking at pronouns, and parents really being worried about what that means for that child going back to school with bullying and increased depression and anxiety in those kids as well. So we've seen quite a bit of that, but along the lines of what Anne had also said that she was noticing, we've also seen more parent engagement. So we've seen more and more parents getting engaged in conversations, having family therapy, working with our family coach that we have that goes into the home to work with the family on their needs and what's going on in their lives, as well as the child, and kind of being that bridge between our therapist. But we've seen them, just the engagement has gone up. They've been stretched so thin, so much is going on that it's kind of that I just can't do this by myself anymore. So again, if there's a silver lining to the pandemic, that's something that we have also seen.
Thank you so much. Very insightful. Let's turn to Chandra. And Chandra, you work directly with kids too. So I really appreciate your insights.
I'm so sorry. Good afternoon, everyone. So I work directly with a very specialized population of youth in the community, ages between the age of 12 and 21. And so over the last 2 years, primarily in this pandemic, we have seen like literally intense and extensive cases of mental health with the young ladies that we work with, from anxiety to PTSD, suicidal ideation, trauma, and different types of sexual assault that they've had to endure within the family and also outside in the community. And so it's been very hard making sure that we are able to get services for them. That virtual component, while it's been there, it's been very hard, but we're, what I call boots on the ground. And
Mhm.
so this conversation is very important because it's also our collaboration with schools, because what we see in the community where we work with the youth, we also have to coordinate and work with the schools. And some of the things that these young ladies and young people are dealing with internally, it goes into the school. And so we have to make sure that that bridge is there, if there's open lines of communication, and just making sure that we're connected so that we can help our youth. And so again, the numbers are really intense. We've seen extensive cases of mental health, and it is very concerning.
Sure, let's continue with you, Chandra. We know that there was an expectation that maybe things would get much better when people returned to school and had the in-person environment. And that didn't turn out to be the case. What are some specific things that are both happening from your vantage point in schools, and what do you think is important that we address?
Well, yeah, we are still seeing the same things that we saw the past 2 years while we were in the pandemic. Again, we are just really, especially this school year, we're really connected with the school social workers, which is very important. And just making sure that we are able to give each child itemized care and individual care. Every child's going to need something different. But I love the fact that between outside organizations and also in the school, we're connecting properly to make sure that we can go and find other services to make sure that the youth are getting what they need, which is key, is that connection, collaboration, making sure that the services are there. The services are there. It's making sure that we are connecting the dots to make sure the child is getting exactly what they need. And so we're doing all kinds of different things, you know, so it's not as simple as just what we're used to, the regular therapists coming in, but also connecting with different organizations and making sure that, like, if there's day treatment, like from Rogers, from that point of view. So we're incorporating all of those different aspects to make sure that the care pattern is there.
Thank you. And can you elaborate a little bit on what districts need and what we're providing? Do schools have the resources they need when it comes to handling mental health concerns in the classroom?
Well, I think the recognition of need has helped channel funding, some of it coming from the American Recovery Act. And even this week, Governor Evers offered additional funding for mental health services in school districts so that each district would have at least one mental health professional available. Those things are all helpful in recognizing the challenges that we have. But it is not just that mental health or clinical connection that kids and families need. It's really the safe and predictable environment, getting kids back to school, experiencing their interaction with their peers and with the professionals who are both educators and who care about them. That also has great therapeutic value. So I do want to underscore that, you know, are there enough resources, which I think you're asking appropriately. When you combine the various resources that students have, I'm actually hopeful. The more that each of us understands as a parent or a professional or just an interested neighbor, grandparent in my case, the more we understand the power of human connection as also being part of the resource pool for the students who might be experiencing challenge. That's true. The neurobiology tells us that. It's hopeful because that means there's more of us to support that healing journey. And I also would underscore the fact that adverse childhood experiences help us understand the context of difficulty, but they are not destiny. They're predictive of risk, so we need to pay attention. But it does not mean that someone with a high ACE score is destined to really bad things. It just means we be mindful of what they might need in order to build resilience and be successful. So that big, are there enough resources question has so many different facets. Caring communities, attentive to their students from little ones all through high school, that's a really good remedy to what we're addressing now too.
Yeah, that's a great takeaway for our audience. We're parents, we're neighbors, we're aunts and uncles, well, I don't know. Do we have any uncles? Maybe. But in any case, we have the ability to make the decision to be important in someone's life. So I know we'll talk a little more about that later. Amanda, anything to add here? If not, I can jump on to the next question.
Yeah, just real quick, when we talk about resources at the school, the other thing that kind of reminds me of is just thinking about, we have a teacher shortage, you know, and teachers have more and more kids in their classroom that they have to be concerned about. So having a teacher who has the ability, even the time, to be able to really focus in on one or two kids that are really having a hard time, it's just not there anymore, which is why these partnerships are so important, so that we can work together. The providers and the school can work together to create plans for the child in a classroom, helping the teacher, making observations in the classroom so that the teacher can, make a few tweaks here and there, while still worrying about the other 24 kids that they have to care for at the exact same time. So I think that those partnerships is really what's going to move this forward and really start to make a difference as well.
Do you want to talk a little more about the specific partnership that you are involved in?
Yeah, so us, along with other organizations, we have partnerships with several schools where we go in and we have a therapist that sits and is a part of that school. One of the things that I like to say when talking with other schools is we want our therapists not to have a visitor badge when they come in. We want them to feel like they are a part of that community that the school has set up. And so we have therapists that work with kids one-on-one. They also invite families in for family therapy. And then one of the other kind of unique components that we have is we have what we call a family coach, who then also goes into the home, acts as that connector between the therapist, will work with the family in the home on psychoeducational, so maybe anger management or factors on how to talk about emotions and feelings with your child. And then also being able to help them with social determinants of health factors, help them figure out how to put together a budget or how to seek food security and what does that look like, and to be able to help them get a job as well. So we try to have our services that work very closely with the entire family and not just the child in that classroom. And then, as a part of that, we bring that back to the school and have those team meetings that we've already talked about, and sitting down and partnering. This is what's going on in the home. This is what's happening with this child in the classroom, and sharing that information so we can provide the best services for the family.
Very good. Let's get more specific about what adults can do as parents or just neighbors or people in the community. Chandra, how would you advise people to show support if they notice someone struggling?
Well, we don't want anyone to diagnose anyone or act like they know that the person has a diagnosis or they know that the person has a certain condition. That's always very risky. So we don't want anyone on the call to do that. But we do want people to just be aware of the people that they are engaging with. I mean, if you see someone and they just seem a little unshaky or they seem a little sad or that kind of thing, don't be afraid to approach them. Don't be afraid to ask, hey, are you okay? And if they're not okay, hey, I'm okay with helping you find some resources to see how you can get some help, from virtual therapy to different types of organizations in the community that are working with people that are dealing with certain things. There's so many different organizations that are doing so many different things. During this pandemic, I know that there's been people who do like hip hop yoga and, different types of things for trauma. And so I think just being the type of person, our Tempo members, right? Being the type of person that's just aware and acknowledge, and then just being compassionate. If you see someone and they need some help, see how you can help them out, not by diagnosing, of course, but offering, hey, I know about this program or that program. And I just think that if we are just very compassionate to others, and we know when something may not be clicking with someone or when someone needs some help, don't be afraid to go ahead and ask and see what kind of resources you can help them find.
I know sometimes people are afraid to say the wrong thing or do the wrong thing, but acknowledging it can be so important in both suicide prevention or just in helping people along to the process of getting the help they need. We'll talk about resources later, but very specifically that one of the links goes to a document about how to be a safe person and what kinds of things you can do to support others. So we'll get to that in a moment. And anything to add about being an adult who's important in a child's life when it comes to mental health?
I thought Chandra did a great job in guiding us to connect. I guess I would add just what the science tells us about the building blocks of well-being. This is for all of us, but especially maybe true for somebody who's having some struggles. The art of listening, so you don't have to be the expert, but that caring ear to help shoulder some of the weight that someone who's struggling with mental illness might have, that is invaluable. It's humane and it's hopeful. Safe, stable, and nurturing relationships are very foundational, not just for kids, but for adults as well. I also would caution how we describe and use the term trauma. You know, every bad thing that happens to somebody is not a trauma. In fact, when we overuse the term, we really, misconstrue what needs to happen. Trauma is a very real physiological response to something bad that's happened. And so in striving to find the right words, just be careful. We're not saying that getting onto the Zoom call was traumatic, or driving in traffic, just a sensitivity around the use of that term. And then Amanda mentioned this, but understanding that social determinants of health are also ways that we as citizens can help others. So housing, food insecurity, the need for stability in someone's life that also is a building block for their own mental health and well-being. Understanding that, and then as we can, acting upon that, either through our own efforts as volunteers or donors, but recognizing some of the stressors of those challenges do increase the risk for mental health challenge.
Great. And Amanda, how are you advising adults to be helpful?
I mean, I really agree with both Chandra and Anne that one trusted adult who can listen really makes a difference in a youth's life, and being able to have one person that they can talk to when they're having a hard day and, things feel overwhelming can be huge, especially when you start talking about kids who might have suicide ideations and need to be able to talk through things. And I love Dan's connection to social determinants of health as well, and how we as citizens in our communities can really participate in that and helping alleviate some of those stressors as well.
Very good. I know I mentioned and referenced that Safe Person initiative where there's a little education around it, but I hope it's okay if I just go through a few of those ideas and see if anyone wants to comment on them. First, when you're noticing something, if someone talks about a mental health issue, just acknowledging that reaching out for support is strength. Listening, we just talked about that, reacting non-judgmentally, responding in a calm and reassuring manner, and then maybe reflecting back feelings, strengths, and ideas when listening. I'm hearing you talk about X, that's is that what you're feeling? Or I'm noticing that you're very strong when you talk about this. More importantly, asking how you could be helpful, how you could be responding that would be positive. And then not treating or offering the actual advice, but doing what you can as an adult to connect to other supports if the person is open. And then finally, just maintaining confidentiality and communicate. Sometimes there are exceptions when you have to communicate to someone else, but in general, that keeping that privacy. Anyone want to jump in with further thoughts on any of that? Okay, well, we'll reflect that it is one of the links that will be shared later. I want to just take a moment and check to see if we have any audience questions. Let's see here. We have someone saying they have a teenage daughter and 5-year-old son. Both have been impacted by what they see and hear, school shootings, parade tragedies, etc., in the media and with friends. Knowing that they're at different levels of understanding with all of this, teenage and 5-year-old, that makes sense. What are some tips to be able to change that tone and dialogue when communicating? Chandra, any advice on that?
I first want to address, because I think it's really important. I'd love to hear what the others on the panel would like to say about this. But I think that we're in a season that we see a lot. Our children, they see a lot on television. So I can only imagine a child seeing when they come home from school, or when they come home, from playing, and they see like what's happened, what school shooting, what grocery store shooting. And so we do need to address that question that she said, like her kids are seeing a lot, on television. So Amanda, what would you say about that? Like, what is some good advice that we could give our audience? Like when kids come home and they see all of the mass shootings and they see like the different things that are going on, how do we cover our communities? How can we help with that? I never really thought about that until that question came over, but that's really good. Don't want to stick to it, but I think that we should, open that up a little bit.
Mm-hmm.
Yeah, and I have an 8-year-old son who has come with questions as well, and have talked about it. And part of what I have found is very helpful is even just asking him, what is it that you're concerned about or worrying about? Because sometimes when we have kids come to us, we assume they're thinking what we think, and a way a 5-year-old or an 8-year-old interprets what they're seeing is very different. But we jump to the conclusion of an adult brain and how the adult brain is processing it. So even being able to ask, what is it that you're worried about? What is it that you see? What did you think about it? Then sometimes we can address what they're actually questioning rather than our assumptions of what they're questioning. So that's the first thing that comes to mind as a place to start. Because oftentimes it's probably not as scary as we are assuming where their head is at. It's just a myth they don't understand.
And I guess also asking them, how are you feeling about what you've seen and what you heard? Do you want to talk about it? Maybe it's okay to talk at the dinner table or at snack or right before bedtime. How are you feeling? I know that you're aware that, you heard about this shooting. How do you feel? Do you feel safe? Can we talk about it? So just making sure that we have that safe spaces for our children, but allowing them to let us know how they feel and what they're thinking.
Sure. One of the other questions that came in is one I hear a lot when we're talking about finding a therapist or counselor for a young person or even adult, really. How do you find the right fit and make sure it's working for them? Especially as a parent, you want to respect the confidentiality and not delve in too deeply about how it's going and ask so many questions. But at the same time, you want to make sure it's working. Any advice on that?
I guess I would, in that thoughtful question, validate the reality that in Wisconsin, the available clinicians is a ratio beneath what's optimal. So we do sometimes see long time wait lists for service, and that makes parents anxious if they have to wait, to then also have a concern about goodness of fit. But parents know their children best. And if there is a situation where the match between the child or the patient and the person providing the care isn't optimal, advocate for your child and seek an alternative. It doesn't mean the clinician is a bad person or even ineffective, but we all talked about the importance of safe and stable relationships. So if that connection isn't there, it's harder for that therapeutic process to be as successful as it might be. And I think sometimes in medical care and mental health care, all of us, despite what we do in our day jobs, can be intimidated by the system. So we're reluctant to say, hey, wait a minute, I think we need to go a different direction. That might be exactly what's needed in order to find the right match.
I know from my experience, when I have done therapy with youth and young children, so sometimes the session would go for like 45 minutes, and then like maybe the last 10 minutes, the child would be able to go out and wait in the waiting room, and the parent would be able to come in. Now, we would not discuss what the child and I talked about, but the parent can say, well, what kind of techniques are you using? What kind of, road are you going through? And so that is another way for the parent to connect with the therapist to figure out like, so what is the plan to basically help my child? And so you can say, well, I'm using talk therapy, or, the parent is able to connect with the therapist to figure out the roadmap that they're going to use to try to help the child without breaking confidentiality. And so it brings a better connection as well. So parents are able to use that as well to advocate for their children, to get to know that therapist, to make sure that there's a good fit without breaking confidentiality.
Great. I think Amanda did talk earlier about the importance of family engagement and a family coach. Can you say more about that? How important is it that parents and families are involved?
I mean, when you look at especially school-based mental health services, the therapist is right there in the school. The child comes from a class and goes, it's great for access to services. It allows parents not to take off of work to have to take their child to an appointment. It's fantastic, but it can also be very difficult then to connect with the family and the parents. So being able to have that communication and being able to have the family coach that we're lucky enough to have to kind of piece that together is huge, but that's not always an option. So really figuring it out, because if you are there and you're able to talk with that child and help them process whatever it is that they came to you for, that's fantastic. It's going to help, it's going to make a difference. But if you can get that same environment to be reproduced in the home, the impact is going to be huge. And it's going to affect not only that child, but that whole family and the way that they communicate and interact and learn from each other. So it's, either way, you're going to see progress, but when you get that family engagement, it's a kind of that extra push to move it forward.
Good. I know that this topic is heavy, and I'm wondering, I would think it might be adding to a little anxiety for parents and possibly fears. Can anyone kind of mitigate fears of parents as they address this, address the realities of our current situation?
That's a daunting task in these times. I think about how we offered the suggestion of, caution around dosing of news and difficult events for our children. That's also true for us as caring adults, to be careful that in our daily lives, the volume of information that's negative, becomes overwhelming to us. So just taking care of our own well-being as it relates to simple things like not fixating or focusing on the very difficult things, while still maintaining empathy, that they're real. I'm not suggesting a Pollyanna approach, but just ensuring that we're cautious around our own behavior and our own attitude about some of this really challenging news that we absorb due to the exacerbation, I'll choose that word, of social media influence in our lives. Just recognizing our own need for being whole and not too pessimistic ourselves.
Good. Anything to add there, Chandra and Amanda?
Yeah, the only thing that I would add is just kind of touching on what I said before, you know, asking the questions, what is it? What is the fear really about? And getting to the heart of it, whether it's your own or it's, you know, you're speaking about your own child or someone else in the community. Because a lot of times I think we reflect our own fears onto other people, whether it's true or not. And then you're trying to fix a problem that's not there. So really just asking the questions and really listening for the answers, whatever it might be, whether it's what you thought or something completely different. Because then at least you're working towards where the actual root of the problem is.
Thank you. I do have another audience question. A kiddo who stuffs feelings, and we don't always know something is going on until it comes out sideways. How can we be proactive with kids about sensitive topics without causing unnecessary angst or confusion? I mean, in other words, do you bring it up as a parent?
So I think the answer is sometimes, yes. But one of the ways that we can help mitigate that risk of kids keeping all that within is to ensure that we're offering them the opportunity for regulation, so pattern, rhythmic, repetitive activity that helps them feel okay. That might be a physical activity like running or a sport. It might be something else. Maybe they're artistically interested and providing them with the tools and the space for that. That stability or that regulating day can help a lot towards mitigating the risk of them keeping everything inside. They've got outlets that help them balance their day. That science tells us that's a really helpful tool.
Sure, structure and that physical activity, we know that does good things for the brain.
Right.
And I know just in general, I had that compassion resilience training in my bio, and I know from that work just the importance of self-care. And I don't just mean, you know, getting a facial or doing yoga or something like that. Self-care can be about setting boundaries, setting shared expectations. And these are adult concepts, but they apply pretty well to whole families as well, in terms of how the home runs and what do we expect of each other, and when do we need some quiet time away or renewal, for parents and for kids. What do you need right now? And how am I feeling? And what do I need right now? That was one of our EWL Speaker Blitz recommendations the other day on self-compassion, asking that question. Have you seen those kinds of, that kind of advice be helpful in the families that you serve, Chandra and others?
Absolutely. I think that it's really important just to make sure that there are boundaries set up, just because it's helpful for everyone. It is a part of self-care, knowing when you should talk, knowing when you should not talk, knowing when you should approach someone, knowing when you should not, knowing when you know, it's a good time to have certain conversations. So I think the boundaries is all about the self-care. And just making sure that you're ensuring that you're not doing too much in the relationship, right? Where people want to stay away from you. You want to just make sure that you're creating safe spaces and consistent spaces.
Good. So we've been focusing for the last little bit on the family unit and parents and relationships. Let's step back again a bit and talk about what we can do at the community level and the state. You mentioned more funding at our state level, but even nationally, what is needed? Anne, what do you see from your perspective when it comes to focus on mental health and addiction?
So I would guess that the people that are with us today as a part of this conversation are here because they care about and recognize how critical mental health is to our success as individuals and as a society. So for me, if that assumption is true, that does mean education around issues of policy, which of course lead to issues around funding, and to really, if mental health is a priority for you as a citizen, then do some homework on the people that are running for office at the school board level, which right now there are so many hot topics and tensions at that school board level, but also in our state and federally elected officials. Who stands for the things that you believe in as it relates to mental health and well-being? This is an election year, so that's an easy and important ask of us as citizens. Mental health isn't a separate thing from all of the other very important things that affect us at the policy level.
Yeah, one of our, I've seen t-shirts that say mental health is health. You cannot separate mental health from physical health, and you can't be completely healthy if that isn't right. Amanda, what are your thoughts?
Yeah, so with advocacy, really thinking about, like you said, mental health is health, and having that parity in the way that we look at it to be able to say the same things that would be covered, are covered in the mental health world. And right now, we don't always see that, especially with insurance companies. Medicaid covers quite a bit, but also reimbursement rates are low when we talk about how we're reimbursing someone with a advanced degree who is, working with high-risk clients in some cases, and looking at that reimbursement rate so we even get more people who want to enter the field, because we've talked about the shortage as well. And we need more people to go into the field of mental health and become therapists and become social workers. And right now, not as many people are going into the field. So it's starting to be an issue now, and it's going to continue to be an issue. In 5 years from now, we're going to have far fewer therapists out there. So really thinking about that. The other thing, so I am a part of 2 different coalitions. One is the Coalition for Expanding School-Based Mental Health in Wisconsin. And it's a statewide coalition. And we also have the Partners of Change Committee, which LSS is the backbone organization for, but we have members from different parts of the state, including Marathon County and Chippewa County and Milwaukee. And both of the coalitions were really working for expanding school-based services. And there has been a lot of progress in that area. There's been a lot of money going towards schools to address mental health. But what I think people don't realize is a lot of that money cannot be used for direct service. So it can be used for teacher training, and it can be used, for some safety measures, bullying programs in schools, which are needed and are great. But we can't keep relying on teachers to be everything for the school, and they need those partners, and we can't expect them to be experts at teaching and experts in mental health. And we really need those partnerships, and we need some of that funding to be able to go towards direct service mental health care, whether that be through the district or through partnerships that they have within the community. So being able to advocate for some of those points. And I'll just throw it out there. If anybody on the call is interested in joining either one of those coalitions, you can email me and I can put you in contact as well. But every year they come out with their legislative priorities, and there's legislative advocacy template letters that come out that can be used, that you can send to your legislators, or talking points you can use to make a phone call. And so there are resources and organizations out there that can help you with those talking points, so you don't have to do it on your own.
Oh, that's great advice. Chandra.
Yeah, I think Anne and Amanda, they said everything. I
Okay.
would back on what Amanda said is just being, the advocacy point is really important. Find your niche, find what you're passionate about in this area, and then just go for it and just be a great advocate to help out.
Great, thank you. I will just mention one other program that I'm aware of through Rogers and our community learning and engagement team, and a program called Coaching for Success that actually goes in and trains counselors to support teachers, and teachers get some more direct support because, as Amanda pointed out, there aren't enough counselors and therapists, and especially in schools. And schools still have the primary goal of, the basic academics too. So the whole shift can't be just on mental health. So any other final thoughts? And then I want to turn it back to Catherine Murray to wrap up. We've really enjoyed our conversation today. Anyone want to add anything? A parting thought? We've covered it. Okay, Catherine, you're on. Thank you so much. It was just a pleasure to talk with all of you.
Well, again, thank you very much, Anne, for all of your work with the behind the scenes planning for today's session. You did a lot of work behind the scenes. Kelsey, if you have the slide, we do have resources that are pulled together that you can see here in front of you. These can be found on the Tempo website. There's really great resources listed here. They will also be sent to all member or participants for today's discussion, along with a link to today's recording. So again, thank you, Anne, for kind of pulling together these resources. Thank you so much to our panelists for your insights and your wisdom. And I'd also like to acknowledge Sharon Hootie, a fellow Temple member and the communications director of LSS. She was also very instrumental in helping us plan and develop today's program. So thank you, Sharon. Before we end today's session, we do want to highlight a few upcoming events. So here on the screen in front of you, you will see some of those. Coming up Monday is an information session for EWL nominations. The nomination period is right around the corner, and this event is designed for all nominees and nominators with any questions on the process, membership criteria, or EWL as a whole. Next week, we return to Tempo's third Thursday program meetings. Our keynote speaker is Kirsten Johnson, Tempo member and Milwaukee County's Health Commissioner. So if you haven't registered for that yet, please do so. On Wednesday, September 21st, EWL members are invited for an exclusive EWL night out at the Milwaukee Night Market. If you're an EWL member, this event is free. It's also the last night market of the summer, so it's the perfect opportunity to enjoy this alongside your fellow EWL members. And then in October, we return with our Real Talks session. Keep an eye out in your Monday message for registration. And then on our next slide, hopefully you've already heard that Selma Blair is coming to Milwaukee for this year's annual leadership event on October 20th at the Miller High Life Theater. There are still tickets available, but the theater is filling up. So this event is open for everyone. Tempo members, EWL members, non-members, all guests are welcome. So be sure to secure your spot as soon as possible if you're interested in attending. And that's all we have for today's session. Thank you again for tuning in. We hope you enjoyed this session on a very important topic. Again, if you would like to reach out to any of our panelists today, their information is available on our Tempo site. You will also be receiving a follow-up with the resources and a recording. So thank you again and have a terrific weekend.
Thank you.